Beijing begins a new round of mass testing in an effort to stop the Omicron BA.2 variant from spreading. Hello, I'm Arnold Naidu, and this is The Heat. We begin in Beijing, where efforts are underway to identify and isolate every new COVID-19 case. Millions of people are undergoing mass testing, and on Friday, all schools will close ahead of next week's May Day holiday. Shanghai remains the hardest hit city in China, with nearly 1,300 local COVID-19 cases and more than 9,000 asymptomatic cases. Shanghai has reported 285 COVID-19 deaths, including 47 on Wednesday. All of the cases, mostly elderly and unvaccinated people, had underlying diseases. Officials are rolling out mobile vaccination clinics in an effort to reach the elderly. For more on the COVID-19 pandemic, let's bring in our panel. Joining us from Virginia is Dr. Tulenko. She's the founder and CEO of Corvus Health. Also with us from the United Kingdom is Dr. Chris Smith. He's a consultant clinical virologist at the University of Cambridge. From South Carolina, Dr. Richard Cheng is the founder and director of Cheng Integrative Health Center and a senior consultant to several hospitals in China. And Victor Gao is a chair professor at Soochow University in Beijing. Thank you, everyone, for being with us. Victor, let's start in Beijing. There is great concern over the spread of this Omicron variant. Mass testing is underway. What can you tell us about the situation there and how people are responding?
Thank you very much. Yes, indeed. I live in Beijing, and over the past 4 days, I already took 2 tests as required by our community leaderships. And this is for the reason that the governments and the health officials wanted to make sure that anyone positive will be identified. And the only effective way is to push through this massive testing. Everyone should be included. No one should be left out. And then the health authorities will have a complete picture of the situation for Beijing, involving a total population of more than 23 million people. Now, only a very small quarter in the whole city of Beijing has been locked down because it has already been discovered and verified that there are positive cases. And in order to cut off the link of spreading to other neighborhoods or communities, this was the extreme measure that the government felt necessary to do. So far, communities and residents in Beijing are fully cooperating with the authorities, and I don't think there is any major inconveniences created, as we have heard about happening in Shanghai. Now, one thing to give the credit to the local authorities is that they already scrambled into action. For example, for that region that being locked down, the government has been delivering food and vegetables to them earlier, ahead of time, rather than lagging behind the curve. So this is something reassuring. I hope the infection cases in Beijing will be identified and put out as quickly as possible, causing less inconvenience to the residents. And I also hope people like me will fully support the health authorities. We know all these inconveniences are for the better good, for the greater good of the whole community in Beijing and for the rest of China.
Richard Cheng, let's look at the situation in Shanghai right now. It's facing a crisis there. Up to 25 million residents have been confined to their homes. And looking at some other figures here, the city has conducted more than 200 million tests, and 300,000 beds have been set up in 120 temporary hospitals. Now, you've worked there. What do you know of the situation there?
Yes, thank you, Anand, for the invitation again. I've been on this program and the other program on CGTN more than a dozen times. Yes, I came from Shanghai. My parents, sisters still live in Shanghai. They are actually locked in the local community. And my parents, they're in their mid and high 80s, and my sisters, they are fine. I told them, they have stocked up food supply and everything. But I have heard from other sources, I don't know, I can verify, of the food shortage from the various channels I've heard. This is very concerning. Yes, it is very concerning. Well, about the lockdown in Shanghai, it's very unfortunate. Early on, over 2 years ago, I remember it was April 2020, when I was, first appeared on the CGTN program, we have promoted about this positive, boosting of our innate immune system. Lockdowns, masks, vaccinations, social distancing, these are all useful and maybe effective ways of passively controlling the spread of virus. However, we have been forgetting the very important component of fighting a viral infection, which is our own immune system. So we have proposed protected population immunity by living a healthy lifestyle, by utilizing vitamins like vitamin C and D. We have talked a lot about it. There are over a dozen clinical trials showing the effectiveness of vitamin C, for example. And also large data, big data survey shows that optimal vitamin D levels are associated with near zero mortality rate of COVID-19. So I believe if our protected population immunity measures were taken, we didn't have to go through this lockdown measures. And so that's the thing. Unfortunately, worldwide, I see very few governments have been listening to or taking measures in this manner.
Right.
Shanghai, yes.
Yeah, so China has adopted the COVID zeros policy. How would you rate or assess that strategy?
The protected population immunity?
No, COVID zero.
Oh, okay. Well, actually, like I said, the problem with the virus is, particularly this SARS-CoV-2 virus, it mutates so rapidly. So the vaccination and the antiviral, specific drugs, these are important and necessary. Unfortunately, there's a huge lag time to research and develop these specific drugs, right? That's all, we all know this. Yep. So by the time you develop a virus-specific drug or vaccine, unfortunately, mutants have already appeared. So I believe this is it is important, but it's only one part of the whole picture. And unfortunately, the way I see it is nearly everything is about vaccination, lockdowns. These, unfortunately, it's not a complete picture. And also, we have seen that of course, it's debatable, but the severity is decreasing, and also the speed of infection contagion is much more rapid. That's accepted, yes.
All right, let's go to the United Kingdom, to Chris Smith. Chris, great to have you with us. The European Union announced that the emergency phase of the pandemic is now over, and the focus will be on vaccination, surveillance, testing. But there was a warning from the Director General of the WHO, the World Health Organization. He warned that a sharp fall in testing could threaten all of us. Let's listen to what he had to say.
As many countries reduce testing, WHO is receiving less and less information about transmission and sequencing. This makes us increasingly blind to patterns of transmission and evolution. But this virus won't go away just because countries stop looking for it. It's still spreading, it's still changing, and it's still killing.
So, Chris, are some countries dropping their guard too soon?
Well, it was actually Professor Gabriasis you were listening to there who very poignantly said 2 years ago, test, 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 and his message hasn't changed, has it? The reality, though, is that countries like the United Kingdom were spending £2 billion a month doing test, test, test. And it gets to a point where it's hard to justify that level of spend when you could say, well, what else could you do with £2 billion of spend on healthcare, for example? So he's absolutely right that we do have to have surveillance, and we are only as good as the knowledge we're armed with, where fighting this virus is concerned. And sharing knowledge and collecting knowledge about how the virus is changing and evolving is critical. But at the same time, when we confront now an infection where the mortality rate is much, much lower than it was, thanks to high levels of population immunity, in the majority of countries around the world, not actually in China for various reasons at the moment, then it becomes a different priority. And so really the emphasis has shifted on to living with COVID rather than trying to control COVID and surveil COVID at quite the extent and quite the extreme we were before. But certainly he's right in the sense that we do need to keep a weather eye on it. We need that virological radar screen to keep blinking so that we can keep our eye on what the virus's next move might be, and that will inform where the science goes.
And what is the situation right now in the United Kingdom, Chris?
Well, 2 weeks ago, 3 weeks ago, I would have said good afternoon from the country with 5 million COVID cases per week. You were just hearing about the numbers in Shanghai. Well, we are doing 1,000 times that number a day. Now we're at about 3.5 to 3 million cases per week. So in other words, we've reached a high watermark and the levels are coming down. And they're coming down for a number of reasons. One is that there's been a reinvigoration of the booster program in order to re-prime people's immunity who are at the most vulnerable end of the spectrum. But at the same time, when you have high levels of disease transmission through the population, like we have had, but with an albeit milder form of the infection, it will prime people's immunity quite strongly. We know from science that's being done now that that immunity persists for quite a long time. And so as a result, the virus essentially runs out of people to infect. The easy, low-hanging fruit of infection has been plucked. And that means actually numbers tend to fall. And as the weather improves, believe it or not, we're apparently heading into summer, although it's pretty cold here at the moment this evening. As we go into summer, viruses of all persuasions find it much harder to transmit. So there's a range of reasons why those numbers will continue to come down. And we're looking forward to a summer with lower levels. But what we mustn't do is take our eye off what will happen in the winter. So that's going to be the question that really is going to be bothering politicians, policymakers and scientists as we go across summer. What are we going to do about the autumn?
Kate Tulenko, let's look at some of the developments here in the United States. The pharmaceutical company Moderna, now they've asked the U.S. Food and Drug Administration, the FDA as it's known, to authorize a vaccine for toddlers, for infants and for preschoolers. And up to now, that age group has not been protected. I mean, what kind of a game changer would that be if it is approved? We have lost Kate. Apologies. Let me go back to Victor in Beijing. Victor, Beijing has announced that all schools will close for in-person classes, that is, and 1/3 of the cases are actually linked to students. Of course, this is going to cause disruptions at school. How long do you think it'll be before children will be able to go back to school?
Yes, indeed. Effective yesterday, schools, including high school, middle school, primary school, as well as kindergartens in Beijing, are shut down ahead of schedule. And this is also in conjunction of the May the 1st holiday, which will last for about 3 days. This is an extra precaution taken, especially to protect the kids. And I think this is really very reassuring to many families in Beijing because the kids need to have extra protection. But allow me to add one point very quickly. I think to be an advocate of what China is doing since the outbreak of this pandemic. Now, first of all, you need to put science first. Then secondly, I think China has made a big choice because if we look at the numbers in the United States, on a pro rata basis, because the Chinese population is more than 4 times larger than that of the United States already had deaths related to COVID above 1 million. So you are talking about potential deaths in China above 4 million or 5 million people. And infection cases probably will run as high as 500 million to 600 million. Now, China has made a choice. We do not want to have this. We want to do whatever we can, to spend whatever resources we can, to leave no stones unturned, to prevent as many people from dying from COVID and to prevent as many people from getting infections from the COVID. This is a political choice. Right. And I think this is supported by all the people, despite of all the inconveniences that we have to go through.
Okay, we are happy to report that Kate is back with us. Kate, we were talking about that application by the pharmaceutical company Moderna to get approval for a vaccine for infants, toddlers, and preschoolers. And the question was, how would that change things across the country if it is approved?
It could potentially be a game changer because this population of 6 months to 5 years, it has been the last population globally to have access to the vaccine. And although not many of these children tend to die or get very sick, they do transmit it to grandparents, parents, other family members with immune challenges. So I think there will be relatively high uptake. Some people may wait until August, September when school's about to start again and vaccinate them at that time. But as was mentioned before, I think there will be a large push in August and September to get everybody vaccinated again as the weather cools, as humidity drops, and viruses can spread much more easily.
And Kate, what about the effectiveness of the vaccines for infants? I mean, some of the tests have shown us that it is effective in about 51% children under 2, that is, and in children aged 2 to 5, it is 37% effective. Why are those numbers so low? Because if we look at the initial vaccines that were given to adults, they were up to 90% effective.
Yeah, so part of that is because children's immune systems tend to be more immature. And that's why we don't, for example, even vaccinate the 6 months old and younger. So it's due to that maturity. But it will, with repeated boosters, most likely the evidence will show that they will get a higher response after that. But it's still worth doing because the complication rate has been very low in this group. And it's an individual decision that each family will make.
Richard Cheng, if we look at China again, more than 91% of China's population has had at least 1 dose of the vaccine, and there's a big push right now to get elderly Chinese vaccinated. Why hasn't China accessed vaccines from other places? Why has it decided to just go it alone?
Well, that's a great question, Anand. Yes, actually, I have read reports on scientific literature from the chief consultant over there, Dr. Cheng. Actually, probably over about 86% of the people have received 2 doses of vaccination, and yet we still see this breakthrough, infection. So that is really a problem. And of the fast vaccination, fast among the, like Chris or Victor were talking about earlier, lots of money spent on this, lots of labor, lockdowns, testings, and yet. Well, that's a good question. I believe this is a political question for a medical doctor. It's very hard to answer. But what I'm saying again here is that, all we hear about is we are focusing on one side of the equation. Do not forget that how we develop COVID-19, how the society reacts to COVID-19 is a bi-sided equation. Virus is on one side, and our immunity, our measures, passive and active, are the other. So we've been only talking about passive measures. That is incomplete. That I've been shouting on this program for over the past 2 years. Do not forget, trust our own body. Humanity, the animal kingdom, has been around for over billions of years. Humans have been around for millions of years. We did not survive until today because we had vaccines, we had antibiotics or antivirals, because we had a powerful innate immune system. And that, unfortunately, has been greatly either ignored intentionally or forgotten. That is the key message I hope our audience will hear.
Okay, Chris Smith, there's a new study in the United Kingdom which shows that up to 2/3 of people, more than 2/3 in fact, who've been hospitalized still have symptoms a year later. What can you tell us about this study, and where do efforts stand on finding an effective treatment?
Well, not long after we first began to chart the course of this new coronavirus through the population, people began to talk about this mysterious series of symptoms that they experienced as a legacy effect of having caught it. And they ranged in severity, some very mild, some much more severe. some people, having barely been infected or barely knew they were infected with coronavirus, were then struck down with quite devastating symptoms. And this all became united under the umbrella term long COVID. But actually no one could really agree what long COVID is. But what we think is going on is that we've got this term which unites a prior diagnosis with coronavirus with a constellation of symptoms that occur in the aftermath. And they probably arise for a range of different reasons and a range of different routes and mechanisms in a range of different people in a range of different severities of disease. So the key thing here is that we study this and we try to understand who is it affecting, who is susceptible, and is this really any different from what, if we had a flu pandemic, you would see in the aftermath of flu? Because most viruses do produce some kind of viral aftermath, some kind of post-viral syndrome. And glandular fever is a good example. Shingles is a good example. Measles is a really good example. So is it just that we're seeing enormous numbers of COVID cases, people are talking about it, there's an element of recall bias in there, or is there something else? Or is it actually both? Are there people afflicted in some way by something that's caused by COVID, but also there are other people who are just suffering a post-virus effect that persists for a while? At the moment, I think the jury's out. We don't actually have a definition of what long COVID really is other than this constellation of symptoms. People are aggressively pursuing this though, and if we can come up with ways to identify who's at risk and also to test for who's got some of these manifestations and understand the mechanism of those manifestations. Once you understand how something works, what makes the clock tick, then you can start moving the hands in the right direction. And that's really the direction of travel. But at the moment, we're very much in sort of listening and learning mode because we're dealing with a very uncertain entity.
Tulenko, if we look at how the virus behaves and how it infects people, I mean, we've got some data from the CDC here in the United States, which says that 60% of those infected by COVID-19, they were infected between December and February. What does that tell us?
Well, it tells us as far as the perspective of long COVID, the worst is probably yet to come. I wanted to talk a little bit more about the long COVID and how it's being seen in the U.S. And actually, the American Medical Association just voted in favor of creating a new medical code, an international classifications of disease code for long COVID. And it's thought now that there are probably 3 types of long COVID. The first 2 are similar to what Dr. Smith was describing, that there's a type that's a result of direct damage from the virus, lung cells actually being killed and the person having to recover from that. The second type is the result of prolonged hospitalization. You get muscle wasting from being in bed that long, you get cognitive changes, and often people require rehabilitation. And then the third type of long COVID is most likely an autoimmune and chronic inflammatory condition. And we're seeing that women are much more likely to get this, which makes sense because women are much more likely to get autoimmune diseases. So we're beginning to sort some of these things out. But one thing that we know is people who are vaccinated are much less likely to get long COVID.
Chris, are you seeing those categories as well that Kate just outlined?
Yes. Interestingly, what we see is people who are not the oldest and not the youngest in the population. So between about age 35 and 60 seems to be the peak age for long COVID. People who are female certainly seem to be affected more often. And we don't know why those relationships occur. It may be that males are more likely to get more severe disease. And so it might be that that's a sort of subtraction phenomenon. It leaves behind women who weren't quite as severely affected, but were affected nonetheless, and they went on to get long COVID. But again, we just don't know. I mean, there's a constellation of symptoms here, as we were just hearing from Kate, and at the moment it's a question of sorting them out and trying to get to the mechanism of what is causing this, and also not conflating it with other things that are going on, because a really interesting story that's emerging here in the UK, but also now becoming an international thing, is that about a month ago we picked up a very big surge in cases of adenovirus, possibly causing hepatitis, swelling of the liver, in youngsters under the age of 5. And one possibility is that this is a consequence either of prior infection with COVID and then this adenovirus on top, or that people, because they were in isolation, a bit like the people in Shanghai at the moment, and weren't catching all the infections that kiddies would normally catch, they're all catching this all at once, and that in concert with something else is now causing them to get this severe manifestation. So it's not just COVID that we're worried about as a new kid on the biological block at the moment. There are other things going on in parallel.
Victor, what about the impact that these lockdowns are having on the Chinese economy? We just had Premier Li Keqiang, who released a statement this week about the need to place greater emphasis on employment stability.
Absolutely. I think we are fully aware that such massive amount of testing, as well as lockdown or very targeted treatment for the infected, etc., will have a negative impact on the Chinese economy as a whole. However, on the other hand, I think the fact that China has predictability and certainty and a very solid framework to take actions at different stages of this cycle of a virus makes it also very clear that there is a system in China which can scramble into action. So I would say the overall cost to China is actually much less than what appears on the surface, because I think from the very beginning of the outbreak to today, the total cost to China in terms of less people being infected, less people dying, and also people having been going through this kind of testing, isolation, quarantine, lockdown cycles again and again, moving from one city to another, etc. I think the total cost to China is much less, because if you do your business,
right,
you will know for sure that once positive cases are discovered, there will be a set process aimed at eliminating the infections, treating the people with positive verifications, and eventually bringing stability back to the community.
Richard Cheng, I've only got a minute left, and I want to talk a little bit about what we're hearing more and more often, and that is living with COVID. I mean, if we look here in the United States, new cases are on the rise, hospitalizations are on the rise as well, but if we look at the severity of the infection, it's much milder than it was with the first Omicron wave. So what is this, when we talk about living with COVID, what is that?
Yes, great. Actually, that's a great question. 2 points I want to point out. One is that this virus will continue to mutate, and also new viruses, new epidemics will appear. And at my very early episode on CGTN over 2 years ago, I quoted a literature research showing that the worldwide epidemics and the pandemics are rising. So how can we deal with future COVID-19, COVID-25, COVID-30, whatever? And if we were going to repeat the same thing what we did, I'm telling you we're doomed. So again, I'm telling you we need to take active approach. Now, another point I want to make is Chris and Kate were mentioning, talk about mechanisms. Yes, we still don't quite understand all the long COVID and these. However, one of the key mechanisms which I wrote quite a few papers and I treated quite a few consulted water patients on the oxidative stress, which the cytokine storm, which is at the center of the acute severe COVID-19, and also I believe it's also related to the side effects of long COVID and also the COVID vaccines. Not only the oxidative stress cytokine storm is not only limited to COVID-19, but also to other severe viral programs, infections. So antioxidants are the key to treatment.
All right, Richard, we are going to have to end it there. Time's run out for us. Thanks to all our guests for being with us. That's it for this edition of The Heat. I'm Arun Naidu in Washington, D.C.